In today's world, creating effective partnerships is crucial in changing health outcomes for patients of all ages and economic backgrounds. As healthcare continues to change, it is critical that private and public partnerships are established to extend the scope of services available, to increase the effectiveness of delivering those services, and to ensure a positive outcome for the widest number of patients possible. An outstanding example of that is the initiative between the Connecticut Pharmacists Association, the University of Connecticut School of Pharmacy, and the Connecticut Department of Social Services. Working together as a team, they are improving care and services in areas that include Medicare Part D, Connecticut Medicaid, e-prescribing, health insurance exchange, and safe medication use in primary care. In a project deployed in 2010, they engaged an existing network of pharmacists and provided direct patient care for Connecticut Medicaid beneficiaries to optimize their medication therapy.
We took a group of pharmacists that we credentialed through a process, and we contracted with them to provide these direct patient care services. This network has the ability to contract with, payers and employer groups, and we recruit the pharmacists based on the type of service that we want to provide. They're really kind of closing that loop between community pharmacy, healthcare providers, and patient, and really managing and coordinating that patient's medication regimen.
Over the course of 11 months, 88 patients received care from the network pharmacists in the offices of their primary care provider. In the nearly 370 face-to-face encounters with patients, network pharmacists identified 917 drug therapy problems, of which nearly 80% were resolved in just 4 patient-pharmacist encounters. As a result of this work, savings in both medication and overall healthcare expenditures exceeded pharmacist care and network administrative costs by approximately 2.5 times. Participants experienced a 54% improvement in the status of their health, bringing out-of-control conditions to a manageable status. This rapid cycle approach has also resulted in a 49% decrease in adverse drug events which cause actual harm to patients, and has helped reduce potential adverse drug events by 60%.
The majority of the problems you see when you really analyze the root cause have to do as much, if not more so, with clinicians and how they are communicating or not communicating with each other, and not just looking at it's always the patient's issue or the patient's fault about not adhering to meds. It's really important as we're looking at new healthcare delivery models and of care going forward that we really need to almost, I'll use the word, reestablish the working relationship between patients, pharmacists, and physicians. We've kind of lost that. Our healthcare system has become more fragmented and maybe a little too cumbersome.
The partnership benefited patients, caregivers, and their providers through improved medication use and safety, patient education, improved adherence to drug therapy, and resolution of numerous drug-related problems. The results were recognized in the 2011 U.S. Public Health Service Report to the U.S. Surgeon General, and the partnership has been recognized with a 2011 Innovation Award from the Connecticut Business Group on Health.
It was a great project. I think it should be expanded throughout the state, and that's what we're working towards right now. The community has really accepted it, has recognized this as an innovative way to enhance health outcomes and try to control the costs that states are under now.
Beyond its impact in Connecticut, members of the team have been asked to advise pharmacists, academic institutions, and state pharmacy organizations in other states on new care delivery models. APHA Foundation congratulates the Connecticut Department of Social Services, Connecticut Pharmacists Association, and the University of Connecticut School of Pharmacy on being named the 2012 recipient of the Pinnacle Award for voluntary health agencies, nonprofit organizations, associations, government agencies, and public-private partnerships.